So what the challenges were before you came across Wake or you hired them.
Well, some of our challenges in information technology for a healthcare provider, mainline health, is having a data center that has very high availability. As more and more applications become at the forefront of the clinical world and are used by clinical nurses and physicians, there's a higher and higher need to have full availability of our systems at all times of the day. We become so reliant on the electronic medical record in healthcare that anytime you have downtime or you have any disruption of services, it's highly disruptive and it places the patients at risk. So we were looking for a strategy that would make our data center very highly available. And we were looking for an opportunity to find the best way of doing that so that our clinical information systems would be available to our customers, our internal users, 24/7. So that was really the challenge or opportunity that started us on our journey to work with Wake. So that was the very beginning of it. So what we wanted to do was look at high-level strategies, and that's where we first started looking with Wake. We were looking at what opportunities are there for providing this highly available environment, a very secure Tier 3 type of data center that would stand up over time. We knew that there were options. We had a data center in this building. We had many different data centers throughout the hospitals. But we really wanted to understand what was the very best way of providing this type of service to our customers. And Wake came in at the very top level, at the very beginning, and worked with us to develop an overarching strategy. What we did with them was pursue some of the different options. We looked at whether or not we should build or renovate existing data centers, or should we go out and look on the general market and look for places that could provide us a location to do a co-located data center, or should we look for a partner or opportunity that would provide us with a managed services type of environment. So we really worked with Wake to look at that high-level strategy. We were, again, looking for our overarching direction and the big picture. Where did we want to go? And they helped us look at the business impact of these different options. They helped us look at the general and overarching costs of doing some of these, how long it would take, and what some of the pros and cons and what some of the benefits to mainline health, the benefits that would come to us if we were to pursue these various different options. And at a very high level, they were working with me and my senior management team at Mainline Health, as well as members of the board, to help really understand where the industry was going, our industry, technology in general, and why some of these options had some benefits over some of the other options that we were looking at. So from the very start, we were at a very high level and working on strategy. So that's how I first came to work with Wake. I had learned about Wake because we were talking to a couple of our colleagues in the Philadelphia area looking for some different consulting groups, some potential partners who had done a lot of work in the healthcare industry, who understood the technologies and the data center infrastructure, as well as the healthcare business challenges and nuances that come with a 24/7 clinical operation. And when we asked around, looking at different consulting firms, the Wake Technology Services just kept coming up as a highly recommended consulting firm. And again, the very first thing that we did was to do an assessment of where we were and then the high-level strategy of where we should go. I felt very comfortable after doing the strategy that we had selected the right partner because they had really worked through all the different directions that we were going to consider and help myself as well as the rest of the organization feel comfortable that we were going to embark on the right direction. I would highly recommend Wake for an engagement like this at different hospitals or providers throughout the country. I think that they've been a great partner. And I think that's really the key word, that they've been a partner in this. They work very closely, they're very flexible, they understand a lot about our environment and where we're coming from and our constraints, and really try to adapt and be flexible to work with us. But at the same time, reminding us of our goals and objectives, and that we wanted to achieve, and keep us focused on kind of the end goal. And again, we're very instrumental in making sure that we were making progress and getting to where we said we wanted to go with their assistance. So I would have, in fact, I believe I've recommended them because I think they've been just a great partner and have really left a footprint at Mainline Health.